I'm Travis Waswick, and I practice at Sanford, Mayville. I knew I wanted to practice in a rural setting after being involved in the ambulance here in Mayville. When I was in undergrad, I worked on the ambulance here as an EMT to get medical experience, and I loved the community. So what made me decide to apply for the RuralMed program was, I was looking at what I wanted to do after medical school and after residency, and through medical school I had a hard time deciding what exactly it is I wanted to do, and I liked OB and I liked emergency medicine and I liked clinic and geriatrics and all these things, and I just finally decided that family medicine was something that could incorporate all those things. And then the next big question was, where do I want to practice? And the practice location where you get you get to do the most things for the most amount of people, I think, in family medicine is a rural setting.
I'm Samantha Kidrowski, and I'm a third-year family medicine resident. I've always had an interest, I think, in going into the health field, but I think my interest in becoming a doctor kind of started in college, probably. When I got into medical school my first year, if you would have asked me, I would have said, no, I'm going to go to a big city, I'm leaving North Dakota. I actually did the Don Breen internship in a rural community here in North Dakota, and I saw how they built relationships with patients. I saw the continuity that they had there, just the relationship with their colleagues, and it was exactly what I wanted to do. And so that really piqued my interest in rural medicine.
My interest in becoming a physician started when I was in junior high. What made me decide to apply for the RuralMed program was the interest in the rural healthcare, wanting to serve those needs of the smaller community, and then just understanding the financial burden as I was going through medical school. When I did my Don Breen externship between the first and second years of medical school, and I really saw what it was like to be a physician in a rural community, that's when I really was solidified in wanting to do that.
I think the best part about the RuralMed program has been really allowing me to focus on my training and on the education that I'm getting, rather than worrying about where am I going to practice, worrying about applications and interviews. I've seen a lot of my classmates struggle with that a little bit, trying to really focus on the now and their education, but also plan for the future.
I made a decision to train in North Dakota because I knew I was going to practice in North Dakota. So without the RuralMed program, I don't know if that would be the case.
The benefit of this program to the state of North Dakota is to keep a steady supply, I think, of rural health physicians. If I didn't have already this program and this job set up, I don't know if I would even be back in North Dakota. Now that I'm in practice, I think the best thing is now not worrying about loans at all. So with having the program just really was a great financial relief for me. It also helped me be prepared to know what job I was going into and kind of tailor my training a little bit more to know what I was going to be doing when I was done, instead of finding a job, second or third year of residency. I knew before I even started residency.
I think if you know that you want to do rural medicine, if you have that passion, you should go for it. It really does give you a sense of relief going through training, to know that you have a place set up to go, to know that your part of your debt is going to be paid for. I just think it's a great program.
So if somebody were to ask me if they should apply for the program, I would definitely say yes.
What I would say to someone interested in applying for the program is to strongly consider it and look into the details. If you know that you want to practice in a rural area in North Dakota, there really is not a lot of downside to doing it.
Over a quarter of the population of North Dakota live in a rural area. If you feel the calling to help serve those people, please look into the RuralMed program. Thank you.